Imagine, you walk into a clinic for a cosmetic treatment. You're wanting to address a feeling of, well, vaginal looseness.
Right, which is incredibly common.
Yeah, exactly. And you're probably expecting a quick, high-tech, maybe just a surface-level laser session.
Like a lunch break procedure.
Right. But instead, the doctor tells you that before they even think about turning that machine on, you need to go into another room.
Take your clothes off, lie down.
Yeah, and get a comprehensive internal pelvic ultrasound, which just seems wild, right?
Welcome to the deep dive, everyone. Today, we're unpacking a really fascinating question.
It's a big one.
It is. Can a pelvic ultrasound actually help before you get a vaginal laxity treatment? And why in the world do we need to look deep inside the body with diagnostic imaging just to treat what feels like a surface-level complaint?
I mean, it sounds incredibly counterintuitive at first glance.
Totally.
If you go in to get, say, a wrinkle lasered off your face, the dermatologist doesn't usually send you for an MRI of your skull, right? They just zap it. So, okay, we have a massive stack of sources today to help us figure this out.
And they are really detailed.
Oh, yeah. We are looking at official clinical imaging guidelines from EvaCore. We've got some very stern safety communications from the FDA.
Which are always interesting to read.
Definitely. And we also have actual treatment protocols from leading gynecology clinics like Dr. Natalia Novakova's, plus clinical trial data, specifically the Velvi-A study.
Yeah, that study is crucial here.
It really is. So our goal today is to cut through all that heavy marketing of these energy-based aesthetic devices. We want to uncover why looking inside isn't just like an extra hurdle or a way to bill you more.
No, it's a crucial first step for your health.
Exactly. Okay, let's unpack this. To understand why the ultrasound is even necessary, we first have to establish what these laxity treatments are actually doing to the human body.
Yeah, the basic biology of it. So the industry categorizes this technology as energy-based devices, or EBDs for short.
And if you're scrolling through social media or, looking at clinic brochures, you are probably being bombarded by intimidating acronyms.
Brand names everywhere.
Right, brand names. We're talking about fractional CO2 lasers, devices like the Mona Lisa Touch or FemiLift.
There are radio frequency, or RF, devices too.
And then there's high-intensity focused ultrasound.
Right, known as HIFU, like the FemiWand.
FemiWand, yeah. And they are all generally being marketed under this umbrella term of vaginal rejuvenation.
Which is such a loaded term. But they are heavily marketed toward a specific set of conditions that clinicians group together as genitourinary syndrome of menopause.
Or GSM.
Yes, GSM. And I want to be clear, this is a very real, very frustrating condition for millions of people.
Absolutely.
It encompasses severe vaginal dryness, tissue atrophy, painful intercourse, and of course, vaginal laxity.
And laxity is just that subjective feeling of looseness, right?
Exactly. It frequently occurs after childbirth or, during the natural hormonal shifts of menopause when your estrogen levels plummet.
But the marketing materials, they make these devices sound like pure magic wands.
Oh, they really do.
You go in, they wave a laser, and suddenly the tissue is completely restored to its premenopausal state. But how are these lasers and radio waves actually altering human tissue? Like, what is the biological mechanism here?
Right, the granular details. Well, the underlying mechanism basically boils down to controlled thermal injury.
Meaning they burn it.
Well, not quite a burn. Regardless of whether a clinic is using a fractional CO2 laser or a radio frequency wand, the device is carefully calibrated. It heats the connective tissue at the vaginal wall to a very specific narrow temperature window.
Which is what?
Between 40 and 42 degrees Celsius.
Okay, 40 to 42, so that's warm, maybe even a little hot, but it's not boiling.
Right.
It sounds like just enough heat to trigger, like, a cellular alarm system.
But that alarm system is the entire point. By safely heating the tissue to that exact threshold, the device creates a microinjury.
Okay, so the body senses damage.
Yes. The body perceives this heat as tissue damage and rushes to heal it. The immediate response is a contraction of the existing collagen fibers. They literally shrink and tighten up.
So you do get an immediate firming effect.
You do, but the more profound change happens over the following weeks.
Right, the long-term healing.
Exactly. The thermal stress activates these specialized cells called fibroblasts. And these fibroblasts go into overdrive, kicking off a biological cascade called neocollagenesis.
Neocollagenesis, that just means new collagen, right?
In plain terms, yes. The creation of brand new, fresh collagen. And at the same time, the body initiates angiogenesis.
Which is blood vessels.
You got it. The formation of new, healthy blood vessels in the vaginal mucosa. So more blood flow means thicker, more elastic, much better lubricated tissue.
Okay, I want to pause on that for a second because this is where the terminology feels a bit, I don't know, slippery.
How so?
Well, when clinics advertise tightening, a lot of people probably assume they are tightening the actual muscle. I mean, the vagina is a muscular canal.
Right, it is.
Is this laser going in and acting like a localized workout for the pelvic floor muscles? Let me try an analogy.
Okay, let's hear it.
If the vaginal canal is a sagging mattress, is this laser fixing the broken springs or is it just pulling the bed sheets tighter?
That is a brilliant analogy. The laser is exclusively pulling the bed sheets tighter.
Wow, okay.
Yeah, that is a vital distinction to make. These energy-based devices improve the mucosa, the lining and the elasticity of the superficial tissue.
The sheets.
Sheets, they can thicken that lining and restore moisture, but they do absolutely nothing to repair severely torn, stretched, or weakened pelvic floor muscles.
So they cannot fix the mattress springs?
They absolutely cannot fix the springs.
So if a patient has a deep muscular issue, like a broken spring, and they go to a med spa that only offers bedsheet tightening,
They're in for a bad time.
right, they are paying thousands of dollars for a treatment that biologically cannot solve their main problem.
They will be incredibly disappointed. And, depending on the underlying issue, they could actually be physically harmed.
Wow. Harmed how?
Treating surface-level tissue without understanding the structural reality beneath it is incredibly risky.
Well, that brings us right to the FDA safety communication from our sources, because the federal government actually had to step in here.
Yes, they did, in July 2018.
Right. They issued a very stern public warning about this exact practice.
What's fascinating here is that the FDA explicitly stated they have not cleared these energy-based devices for treating specific gynecological conditions.
Things like urinary incontinence or sexual dysfunction.
Exactly. The clearance these machines have is generally for destroying abnormal cervical or vaginal tissue, things like warts.
So the whole rejuvenation aspect is considered off-label use.
Yes, entirely off-label.
And the warning didn't just stop at, this might not work. The FDA pointed to serious documented adverse events reported by actual patients.
Very serious events.
We are talking about vaginal burns, severe scarring, and recurring chronic pain following these supposedly simple cosmetic procedures.
And the core issue here is that vaginal rejuvenation is just an ill-defined marketing term.
Right. It's not a real diagnosis.
No, you won't find it in a medical textbook as a specific disease state.
Mm.
It is a catch-all phrase designed to sell a feeling of restored youth.
Right.
The medical reality is that the symptom of vaginal looseness can be caused by entirely different root problems.
Okay, let's break those root problems down. Based on the clinical literature we reviewed, a feeling of looseness can simply be a symptom of tissue laxity.
Which is the bedsheets needing tightening.
Exactly. But it can also be a symptom of weak pelvic floor muscles. Or, most alarmingly, it can be an early sign of pelvic organ prolapse.
Yes, and pelvic organ prolapse is a massive structural failure.
Walk us through what that actually looks like structurally.
So the pelvic floor is essentially a muscular hammock. It holds up the bladder, the uterus, and the bowel.
Okay.
If those muscles and ligaments tear or stretch too much, which often happens due to traumatic childbirth or severe strain, that hammock gives way. Yeah. One or more of those pelvic organs physically drops out of its normal anatomical position.
Mm-hmm.
It begins to bulge down into the vaginal canal.
So, if a patient comes in complaining of a heavy, loose feeling, and it's actually a prolapsing bladder,
Right.
applying a 42-degree laser to the surface of the vaginal wall is not going to push that bladder back up.
Not even a little bit.
That sounds like turning off a blaring smoke detector and going back to sleep while your house is actively on fire.
That's exactly what it is. It masks the real issue. The provider might temporarily improve the surface tissue, maybe increase some lubrication,
Sure.
but the structural organ failure is still progressing. That is the critical danger of misdiagnosis.
So if a clinician just listens to a patient's subjective complaint of laxity and immediately reaches for the laser, they are ignoring the structural foundation of the body.
Entirely.
Okay, I have to stop you there, though. I want to play devil's advocate for a second.
Go for it.
Because this sounds like an incredibly high barrier to entry. Say a woman is in her late 50s. She's experiencing some frustrating dryness and a bit of laxity from menopause.
Pretty common. So.
Very common. And she just wants a quick 15-minute laser fix at her local med spa, making her go get a full invasive ultrasound, an up-to-date pap smear, and a physical exam. I mean, it feels like massive medical gatekeeping.
I get that. It really does feel like gatekeeping.
Right. Is all of that diagnostic testing really necessary for what is effectively a cosmetic laser?
It feels like gatekeeping until you look at the clinical data of what happens when providers fly blind.
Okay, sure.
Let's look at the protocols from Dr. Natalia Novikova. She's a prominent gynecologist whose clinic policies we reviewed.
And what does she mandate?
She absolutely mandates a pelvic examination, a pap smear, and a dedicated pelvic ultrasound before any laser treatment is even discussed.
Wow. Here's where it gets really interesting, though. The EviCore imaging guidelines, which are, what insurance companies and medical professionals use as the gold standard.
Yes, to determine when imaging is medically necessary.
Right. They lay out exactly how detailed this ultrasound needs to be.
And the standard assessment here is a transvaginal ultrasound.
Okay, walk us through that.
It's non-invasive, it uses high-frequency sound waves, and it has zero ionizing radiation.
Which means it's not like an X-ray.
Exactly. It's incredibly safe compared to an X-ray or a CT scan. The sonographer uses a thin transducer wand. It's about 1.5 inches in diameter.
Basically like a slightly larger tampon.
Right. It's covered with a sterile sheath and gel, and by inserting it gently into the vaginal canal, the high-frequency sound waves can bounce off the internal organs directly.
Bypassing the stomach entirely.
Yeah.
Because, if you just scan from the outside over the belly, those sound waves have to travel through layers of fat, muscle, and a full bladder.
Just to get a blurry picture of what's underneath.
Exactly. So going transvaginal makes a huge difference.
It provides a highly detailed, crystal clear view of the uterus, the cervix, the fallopian tubes, and the ovaries. And the goal isn't just to look for prolapse. It allows the clinician to scan for absolute contraindications to laser therapy.
Let's bring in the Velvet trial data to really understand those contraindications, because this was a major, rigorous study.
The benchmark study, really?
Yeah. It compared fractional CO2 vaginal laser therapy against the traditional treatment, which is just vaginal estrogen cream. And they didn't just let anyone with a complaint of looseness into this trial.
Not at all. The researchers had strict, non-negotiable exclusion criteria.
Like what?
Well, they explicitly barred any patient with a pelvic organ prolapse of stage 2 or higher from participating.
And stage 2 means the prolapsing organ has actually dropped down to the opening of the vagina.
Yes.
They excluded them because the researchers knew a laser physically cannot fix a prolapse, and applying thermal heat to a dropping organ is just an unnecessary risk.
Exactly. They also excluded patients with undiagnosed vaginal bleeding, underlying fibroids, or active ovarian cysts.
They had to be sure.
Right. The trial was designed to prove that the laser worked for mucosal issues. So they had to medically verify that the patients actually only had mucosal issues.
But the reality is that many standalone cosmetic clinics, the med spas at the strip mall, they don't operate with the rigor of a clinical trial.
Sadly, no.
They might lease the expensive laser machine, but they do not employ trained sonographers, nor do they have the ultrasound equipment on site.
They skip the diagnostic step entirely and go straight to the profitable treatment.
And skipping that diagnostic step is where we see the most terrifying medical misses.
It really is.
Let's go back to the EviCore guidelines and look at a very specific, dangerous scenario. The guidelines note that abnormal vaginal bleeding is a presenting symptom in 90% of postmenopausal women who develop endometrial cancer.
That is a staggering statistic.
Yeah.
And during a transvaginal ultrasound, one of the key things the sonographer measures is the endometrial strip.
Which is the lining of the uterus.
Yes. And the guidelines state that an endometrial strip measuring 4 millimeters or less on an ultrasound has a greater than 99% negative predictive value for endometrial cancer.
Okay, let's translate that heavy statistical jargon for a second. Negative predictive value.
Right. What does that actually mean?
In plain English, that means if the ultrasound shows that the lining of the uterus is 4 millimeters thin or less, the doctor can be over 99% sure that cancer is not present.
That measurement provides massive peace of mind. Now, picture a postmenopausal woman walking into a purely cosmetic clinic.
Okay.
She's experiencing vaginal dryness, maybe a little bit of unusual spotting, and painful sex.
Pretty standard menopause symptoms.
Right. She thinks this is just menopause, I need a laser rejuvenation.
Yeah.
If that clinic does not perform an ultrasound, they might miss the fact that her endometrial lining is actually 10 or 12 millimeters thick.
Oh, wow. So they might apply the laser to the vaginal wall, completely turning off the fire alarm by temporarily improving her dryness, while entirely ignoring a developing endometrial cancer hidden just centimeters away.
Exactly. The ultrasound forces the provider to look at the entire anatomical picture. It ensures that life-threatening underlying pathologies aren't ignored while a patient is simply seeking relief for painful intercourse.
Which is totally understandable to seek relief for.
Of course. But you cannot ethically treat a cosmetic complaint without first ruling out a pathological disease.
So what does this all mean for the listener? Let's talk about how this ultrasound data actually dictates the treatment plan, because it isn't just a tool for saying no to a patient.
Not at all. It acts as a map to help the doctor find the right yes.
Right.
The ultrasound is the ultimate sorting mechanism. Let's say the imaging and the physical exam reveal that the patient does have a structural prolapse or severe muscle weakness.
The mattress springs are broken.
Springs are breaking. In that scenario, the clinical literature from places like Modern Women's Health directs the patient away from the energy-based devices entirely.
They point them toward pelvic floor physiotherapy instead.
Yes. Working with a specialized physical therapist, they might use weighted vaginal cones, biofeedback machines, or targeted exercises to actively rebuild the muscle tissue.
And if it's even worse than that?
If the ultrasound shows the prolapse is severe enough, the data points the patient toward a surgical consultation to physically repair the anatomical failure.
Okay, but on the flip side, let's say the ultrasound comes back totally clear.
The ideal scenario.
Right. The organs are perfectly healthy, there are no ovarian cysts, the endometrial strip is a healthy 3 millimeters, and there is absolutely no evidence of a prolapse.
In that case, the patient is officially cleared for the energy-based device.
Awesome!
The doctor can look at the patient and confidently say, your muscular foundation is solid, your springs are intact.
Your symptoms are being caused by a mucosal collagen issue.
Right, and we can safely treat that with the fractional CO2 laser.
You know, while I was looking through the EvaCore imaging guidelines, I noticed a detail that completely threw me off.
Oh yeah, what was that?
We've been talking about transvaginal ultrasounds where the probe goes inside. But the guidelines also specifically recommend something called a transperineal ultrasound for certain pelvic floor assessments.
Ah, yes. That is a brilliant diagnostic alternative.
I was confused by it. So a transvaginal ultrasound involves inserting the probe into the body. A transperineal ultrasound places the probe completely on the outside.
Yes, resting it on the perineum. That's the small area of skin between the vagina and the rectum.
But why use an outside probe if the whole point is getting a close-up look at the internal organs? Doesn't the transvaginal one get you closer?
It does get you closer.
Yeah.
But there is a physical drawback to inserting the probe.
Which is?
The transvaginal wand takes up space. When you insert it, it can physically push the vaginal walls and the bladder neck out of their natural positions.
Oh, I see.
Yeah, a transperineal ultrasound allows the clinician to observe the pelvic floor and the urethra in their natural resting, undisturbed state.
So they can see how the tissue actually behaves without a medical instrument, propping it open.
Furthermore, a transperineal ultrasound is a dynamic, real-time exam.
What does dynamic mean in this context?
It means the sonographer can ask the patient to cough or bear down as if they were having a bowel movement while the probe is resting on the outside.
Oh, wow. So they can watch the organs move while the patient is awake and actively creating pressure.
Exactly. They can see in real time how the bladder neck drops under stress. They can spot a subtle, hidden prolapse that only occurs when the patient is lifting something heavy.
That is fascinating.
It is. They can even identify a hidden urethral mass that a static, stationary transvaginal image might miss entirely, simply because the internal probe was pushing against it and flattening it out.
Okay, so if you are listening to this deep dive and you've been considering one of these heavily advertised FemiWand or Mona Lisa Touch procedures, the core takeaway from all these medical protocols is pretty clear.
Very clear.
The pelvic ultrasound acts as your ultimate medical gatekeeper.
If we connect this to the bigger picture, it performs two vital protective functions.
First, it protects your wallet.
Yes, it really does.
It stops you from spending thousands of dollars out of pocket on a laser treatment that physically cannot work for your specific anatomy. Because your issue is deep and muscular, not surface and mucosal.
And second, and much more importantly, it protects your life.
Absolutely.
It ensures you aren't masking a serious medical condition. Things like a fibroid, an active cyst, or a cancer risk, something that just happens to be masquerading as a simple cosmetic complaint.
Looking at this comprehensively really redefines what intimate health actually means in modern medicine, doesn't it?
It does. True intimate health isn't achieved by just pointing a laser at a subjective complaint based on a 5-minute consultation.
Right.
It requires combining the patient's subjective experience with objective diagnostic truth.
And the leading clinics use validated tools for that, right? Like the vaginal laxity questionnaire or the visual analog scale for pain, to deeply understand how the patient is feeling.
Yes, those questionnaires are crucial, but they pair those questionnaires with the ultrasound to definitively prove why the patient is feeling that way.
So proper diagnostic screening, followed by a rigorous informed consent process based on actual imaging data. That is the ethical boundary.
That is the line separating genuine, patient-centric medical care from unadulterated commercialism in the med spa industry.
It's the stark difference between a doctor trying to heal the root cause of your pain and a salesperson trying to sell you a bundled laser package.
Well said.
So, to wrap up our deep dive today, the explosion in high-tech lasers, radiofrequency devices, and focused ultrasound offers genuinely exciting, life-changing possibilities.
For treating vaginal laxity and the painful daily symptoms of menopause.
Right. The technology is very real, the cellular biology of neocollagenesis is proven, and when used correctly, these devices can vastly improve a person's quality of life.
But those high-tech tools are only as effective as the medical diagnosis behind them.
Exactly. Without a precise diagnosis, a medical laser is just a very expensive, potentially dangerous heat lamp.
The pelvic ultrasound is really the unsung hero of this entire medical category.
It's the 15-minute non-invasive map that ensures the high-tech treatment actually matches the true root cause of your symptoms.
It verifies that the structural foundation of the house is secure before anyone tries to paint the walls.
That's a great way to put it. Now, before we go, I want to leave you with a final thought to ponder. We've talked extensively about how ultrasound acts as a gatekeeper today, but ultrasound technology itself is advancing at lightning speed.
It really is incredible how fast it's moving.
We are seeing 3D rendering, artificial intelligence interpretation, and real-time dynamic imaging becoming cheaper, smaller, and vastly more accessible every single year.
The machines are literally shrinking from the size of a refrigerator down to handheld devices that plug into a smartphone.
Yeah, that blows my mind. So as this diagnostic technology becomes as common and portable as a stethoscope, will we soon see a future where the line between cosmetic procedures and deep internal medicine completely disappears?
That's a wild thought.
Think about it. If every single aesthetic clinic can instantly see inside your body in high-definition 3D without needing a massive radiology department, will the beauty and wellness industry be forced to abandon the guesswork and become entirely medically rigorous?
Will the advancement of the technology force the standard of care to catch up across the board?
We will have to wait and see. Thank you so much for joining us on this deep dive. Keep asking the tough questions, demand the full picture from your providers, and always remember to look beneath the surface of your own health. Until next time.